Hi everyone, Mary Jane from Music Therapy Works today, bringing you another Music Therapy Morsel. Today our topic is referral and how music therapists use referrals to help guide treatment decisions and evaluation. Referrals come to us from many different places and are actually a really useful tool when you're starting to develop what type of assessments you want to do with a client, what type of treatment you're going to do with a client, and when to terminate services. Referrals come from all kinds of sources. Sometimes it might be a parent seeking music therapy services for their child in special education because they notice that their child can remember all sorts of information if it's presented in a music therapy format, if it's presented in a musical format, not necessarily a music therapy format. And so they may desire music therapy treatment for their students because they feel like music is a therapeutic element that will assist their student to thrive in school. You may also get a more specific referral, such as from a physician who says, we really want this particular client to be engaged in gait training, specifically because of their current diagnosis of Parkinson's disease and the complications that occur based on that. Basically, referrals establish our desired outcomes, and every music therapy treatment relationship should have a desired outcome. There needs to be a reason why a person is in therapy and an end point, so that way you know when you have finished therapy. One of the important concepts for us as therapists to remember is that it is our job to put ourselves out of a job eventually. And so keeping that in mind as you're going through the therapeutic relationship is really important. So let's go back to the referral. If you receive a very specific referral, we want this child to learn their ABCs through music therapy. That provides you with a very specific format for treatment. If you receive a more general referral, we're referring this child for assessment to see if music therapy is something that will increase their educational benefit and that they will be more successful in their education environment working on their IEP goals through music rather than without music. Then you have a little bit more work to do. So first off, you get the referral. Referrals can come to you from all kinds of sources, physicians, from therapists, from teachers, from parents, from the client themselves. Whatever the situation is, the referral comes to you. Once you find out why a client has been referred to music therapy, why a client wants music therapy, that is your then desired outcome. And that desired outcome becomes the basis of everything else that you do. Once you have that desired outcome figured out, you can then assess. You can figure out the task analysis that happens. You can figure out what you need to be looking at, what questions you need to ask, what charts you need to review, what types of things have to happen for you to gain as much information about the client and where they are on their process towards their desired outcome as you possibly can. That desired outcome then tells you whether or not you need to do a general assessment where you have to evaluate everything that's going on in a client's life, or a specific assessment if you're only going to be focusing on one particular skill. That then leads you into treatment planning, leads you into evaluation of skill, and leads you into termination of clients. So referrals are very important because referrals offer you the desired outcome, which then provides the shape for everything else. This is just a quick taste of one of the things that music therapists think about as they go around doing their jobs. If you're interested in more, please feel free to contact us at contactusmusictherapyworks.com or subscribe to this channel for more information and more morsels as they come around and come due. Thanks a lot for watching and have a wonderful day.